Hi, I'm Micah Waits, and this is the Family Health Assessment of the Romano family. This assessment utilized the Friedman Family Assessment Model in conjunction with Duvall's Family Development Theory and qualitative interview methods to draw conclusions about the family's health and potential threats to their health, to understand the family's developmental stage and context. It examined how internal communication and role structures impact the function of the family unit, and it explored how the family's context within their broader environment and community, and how that environment provides both stress and support to the family unit. The Romanos are a family of 5 with 1 dog residing in Prairieville, Louisiana. They're a nuclear family with a biological father, Mitch, who's 46, a biological mother, Millie, who's 42, a 14-year-old son, Antonio, and twin 9-year-old daughters, Lola and Katie, living in the same household. They're an upper-middle-class family living in a small gated community. They're of Italian heritage on both sides. They practice the Catholic faith, but they do not consider themselves to be devout. They identify as white Caucasian, and English is the only language spoken in the home. They state that they are financially stable and that their income is sufficient to support the lifestyle to which they aspire. Mitch is a landscape architect and entrepreneur. He started his company a couple of years ago. Millie is a marketing and operations executive in the financial services industry at a local credit union. And she recently took a promotion with her company this year. So she's managing the transition well, but she's still adjusting to the new responsibilities and managing a large team. So there's a little bit of stress involved with her job right now. With regard to the family's history, Mitch was an only child. He's been estranged from his father since he was approximately 2 years old. He knows little about him or his health history. Mitch's mother, Angela, is 64. She struggled with substance abuse off and on most of his life and continues to struggle, but he's not aware that she has any other health problems. Due to her ongoing substance abuse, Mitch has a very strained relationship with his mother, and she has little to no involvement with the family as a whole at this point. Millie's parents divorced when she was in high school in 1999. Her father, William, is 76. He's a retired pilot. Her relationship with her father has always been strained, but approximately 7 years ago they had a falling out, and she has not spoken to him in years. He has a history of coronary artery disease, hypertension, heart failure with reduced ejection fraction, and prostate cancer. Millie has a close relationship with her mother, Marie, who's 70. Marie is a retired microbiology lab tech. She has a history of hiatal hernia, GERD, and is a former smoker. Marie is the only grandparent that the family has an active relationship with. Millie's younger sister also lives in Mandeville with her husband and 2 sons, and they see Millie's family every few weeks. Millie's sister is 38, and she is healthy with no pertinent medical history to report. Antonio, who is Mitch and Millie's son, is 14. He's going to be entering the 9th grade at Dutchtown High this fall. He is diagnosed ADHD and is on medication. Katie is 9. She's one of the twin girls. She'll be entering 4th grade this fall at Bluff Ridge Primary, and she is also diagnosed ADHD. Lola is also 9, will be entering 4th grade at Bluff Ridge, and is also diagnosed ADHD and is on meds. With regard to how the family interacts with their environment and larger community, we'll just go kind of around the horn here and look at this diagram and talk about all their community interactions. Mitch's company requires a lot of time, energy, and focus, and since his office is in Metairie, he has a long commute time daily, about an hour, a little over that each way. However, the income that the company has provided is a significant asset to the family, and the nature of the work is a creative outlet for Mitch. Millie's job is somewhat flexible and stable while providing a significant income and benefits for the family, such as health insurance, which is vital since Mitch is self-employed. As mentioned before, Millie is navigating a new role at work, which is challenging, but it has also provided a significant increase in income. Millie's mother and sister are the strongest social supports to the family. However, their location in the Mandeville area so face-to-face interactions are limited to once every few weeks, and they cannot provide any in-person support for the family without significant planning and notice. Mitch and Millie report that they do have friends, but most are not local to them. Most of them live in the New Orleans metro area. In addition, Mitch and Millie are typically the ones that initiate, organize, and host parties and hangouts, so it's probably fair to say that their friendships require more energy input than the support that they give back to the family. Outside of some loose connections with moms in the neighborhood where Katie and Lola play at other friends' houses, they don't really have any significant, consistent friendship support in their local community. Mitch and Millie report that they identify as Catholic and that their faith informs their values, but they do not participate as often as they should in the church. They only go once every few months, and they do not have significant relationships with anybody there. Their involvement with the church community is weak at best and does not represent a significant support to the family. Much of the family's energy and resources go into promoting the children's involvement in school, socially and educationally. Antonio has previously struggled in school from a social perspective, and Lola is currently struggling in math and language arts, requiring summer school each of the last 2 years. Mitch and Millie report that supporting the children's educational endeavors, especially Lola's, consumes much of their spare time and energy throughout the week. And lastly, with regard to their healthcare access, due to their stable and adequate financial situation and their location, the family reports sufficient access to healthcare services, with all their doctors, dentists, etc. being local within 15 minutes of home, and nearby access to hospitals as well. They report that they attend their regular wellness checkups and do not hesitate to seek medical care when they need it. However, they do report that they allow their children to go on and off their ADHD meds during breaks from school. So the developmental stage that the family finds themselves in is the family with school-age children. So a lot of the family interactions, as we discussed, are centered around supporting children as they pursue their education and their social engagements at school. They spend a lot of time collaborating with the school to support social and cognitive development. And then at home, they're also spending time establishing accountability for family rules, roles, and expectations like chores and various responsibilities, manners, that type of thing. In addition, with Antonio entering adolescence, they're also balancing kind of the beginning of the next stage. So they're working on those other things that we talked about, but also allowing Antonio more independence and autonomy, allowing him to be home alone, allowing him more choice in which family activities he attends and which ones he doesn't. And then they're also negotiating their family values in line with his developing individual values. So he's recently become interested in politics, and much to his parents' chagrin, his ideology is not in line with theirs. With regard to family values overall, a couple of the big important ones that were mentioned. Mitch spoke a great deal about work ethic and integrity. He noted that he was able to essentially work himself out of the tumultuous upbringing that he had. He believes that freedom comes from hard work and integrity. And then within the home, there's also a strong emphasis on individual ambition, as both he and Millie are both very driven and goal-oriented at work. And financial success is a validator and a source of pride in the home. Historically, communication style and conflict management have been a point of contention in the family. Mitch's communication style is quiet, measured, and methodical. He prefers to mull and analyze things fully before speaking or acting. He values logic and fact over feelings. He avoids addressing problems before he has all the facts, and he doesn't always find the right words to communicate what he has processed. Millie, on the other hand, is very direct in her communication style and tends to advance her opinion as fact, looking for agreeance or pushback from Mitch. She is more emotionally driven, more black and white, and quick to communicate. She equates passion and urgency with engagement and conviction. She sees quick resolution as important. She's uncomfortable with ambiguity and tends to communicate anger when what she is really feeling is fear, uncertainty, or strong conviction. Mitch's delay in action and quiet demeanor are often mistaken for lack of engagement or aloofness. And Millie's over-the-top emotion, loud volume, and quick judgment are seen by Mitch as a haphazard and overwhelming. This dynamic can breed frustration and resentment, and sometimes takes the collective focus off of the real issue at hand when adversity arises. So this is kind of two sides of this dysfunctional cinder coin, so to speak. These dynamics have trickled down to the children as well. The girls tend to model Millie's communication style, and Antonio tends to model Mitch's, which creates conflict between the children and between child and parent. They do, however, note that while their differing styles are a liability internally in the family, when they're working against external adversity, their differing styles really complement each other well, and they consider them an asset. As far as power bases, Mitch's power base is resource power. His power lies in his resources, relationships, skills, and expertise. Millie represents dominant power. She has a big personality, big temper, and she uses her propensity for yelling to usurp control when she feels like it's warranted. Antonio, his power base is tension management power. He tends to badger and debate to get what he wants. Katie and Lola both represent powerless power. Their go-to is to whine and pout to get what they want, typically. All in all, the power base and continuum structure is a syncretic, egalitarian family. The big decisions are made together between Mitch and Millie with input from both. The children are increasingly a part of the discussions as they get older, but rarely have a direct influence on the decisions. Mitch and Millie mentioned that they want them to be a part of it because they want them to see how decisions are made more than they want their input or influence on the decision. As far as role structure goes, Mitch aligns with the provider and housekeeper roles formally. So his focus is typically on working hard to provide for the family. He's also the one that keeps the house in order, keeps everything clean and organized. He's also the initiator, contributor informally. He typically brings new ideas and direction to the family. Millie is also a provider. She provides a significant income to the family. Her other formal roles are childcare and child socialization, and informally, she's the family coordinator. She coordinates all the social activities, appointments, vacations, kind of the family's social calendar. Antonio, his role is recreation, but increasingly he is involved in the housekeeping activities as well. He does dishes, vacuums, mows a little bit. Informally, he's the blocker. He tends to be contrary just for the sake of being contrary. He likes to kind of stir things up, and he is a little self-focused as well. Katie, her role is recreation. She's always, looking to have fun, and her main focus is play. She's also the recognition seeker, so she wants to be seen as the golden child. She's the one that has the propensity to tattle on the others. Lola is also typically seeking recreation, but informally, she's the pal. She's pretty happy-go-lucky, always looking for the next adventure. With regard to healthcare, we've hit on some of this already. The family is diligent in attending their regular medical and dental checkups. They are up to date on all their regular vaccines with the exception of COVID. They did again note that they allow the children to go on and off their ADHD medications when they're on breaks from school. The one point of contention, Mitch expressed that nutrition in the family has been a source of conflict and contention. He would like to eat a whole food based diet, but Millie, Katie, and Antonio are extremely picky eaters and prefer convenience foods and highly processed food items. Mealtimes are not a cohesive family effort and are more of a free-for-all. Millie stated that she has always been picky and her eating habits were heavily criticized by her father growing up. She admits that she probably carries a lot of baggage centered around food and thus has avoided fighting this battle with her kids. Now that the children are older, Mitch would like to reopen the conversation about shifting their family eating habits to more healthful, nutritious choices. Mitch is fairly active as well. Much of his job has him working outside and moving around a lot, but otherwise no one in the family engages in any regular exercise activities. So as far as family stressors go, we hit on most of these. 4 out of the 5 members of the family are diagnosed with ADHD and are on meds. There's obviously Lola's current school struggles that they're navigating, Millie's new role at work, Mitch's new business, and then the differing communication styles and different ideals on dietary practices and eating patterns as well. As far as coping strategies, several members of the family when they look to cope with adversity, they tend to dissociate or retreat. Mitch will do a form of that in which he pours himself into his work because that's where he feels like he can always be of service. Millie will sometimes get emotional and loud, but then she'll kind of retreat and just go spend time in her room by herself. Antonio, honestly, he kind of retreats whether there's adversity or not. He's just very introverted and avoidant of all conflict unless it's on his terms. So that brings us to our NANDA nursing diagnoses for the family. So my NANDA nursing diagnosis is readiness for enhanced family processes related to expressed interest in reevaluating family health practices and motivation to improve communication and problem solving within the family, as evidenced by identification of poor current dietary choices, difficulty planning and preparing balanced meals, inconsistent routines around meals and exercise, a lack of shared goals regarding health improvement, and a desire for more effective communication within the home. So the goal that I put in place is kind of twofold. So it focuses on the nutrition and dietary aspect as well as the communication aspect. So the family will report more wholesome dietary habits and enhanced structure and communication with respect to meal planning within 1 month. The outcome that we'd like to see over the next month, the family will work together to plan, cook, and enjoy together 3 nutritious, whole food-based, balanced dinners per week. The interventions I put in place to guide this goal towards this outcome. I'd like to guide the family in a discussion about likes, dislikes, and attitudes towards food and model 1 week of nutritious meal planning for the family. In addition, I'd like to teach the family about best nutrition practices regarding recommended macronutrient intakes, fiber, and important micronutrients, as well as good sources of each. I'd like to teach the family about the importance of balanced nutrition with regard to managing ADHD. And then I'd also like to teach the family how to utilize AI to plan nutritious meal plans and grocery shopping lists with ingredients that they all enjoy or are open to eating. This has honestly been a great thing in my family, and I'd like to pass that on to them. In addition, we can offer a referral to a registered dietitian if needed, and I'd like to follow up in 1 month to evaluate the intervention and the goal progress. My second diagnosis is risk for impaired parenting related to impaired communication and ineffective coping strategies as evidenced by acknowledgement of contentious communication dynamics among members of the family and various family members reporting that their coping strategy is to retreat or dissociate when adversity arises. Within 1 month, the family will demonstrate, so my goal is, within 1 month, the family will demonstrate more proactive coping strategies with regard to conflict and adversity. The outcome I'd like to see over the next month, the family will hold at least one family check-in meeting per week to discuss stressors, accomplishments, frustrations, and goals. The interventions I'd like to put in place to guide this are to teach the family enhanced communication tactics, such as I statements, so like I feel or I think or I would like to versus you always or you do this or you make me feel this way. I'd like to help them with active listening strategies and respectful turn taking and vocal volume control. I'd like to recommend family communication tools like a talking stick. So like when you're holding the stick, you have the floor or family whiteboard or a family whiteboard for notes during these meetings. Then I'd like to facilitate and moderate the first weekly check-in meeting just so they have a good picture of what these meetings are supposed to look like. Lastly, I'd like to follow up in 1 month to evaluate intervention and goal progress. And here are my references. So I did have a couple of references. I used the Nursing Diagnosis Handbook, some additional information on family development theory, and our family healthcare nursing textbook as well.